I'm Dr. Tracy Lotze. I'm a medical physician with experience in almost 20 years. I have emergency experience, urgent care experience, and currently specialize in women's health, hormones, and longevity. Some of the largest health issues that I see in women nowadays include things such as weight gain or inappropriate weight loss, hair loss, stress, and hormone changes. In different life stages, women have different impacts from hormones. If we consider women in their 20s, 30s, and some women still in their 40s, they will have hormonal changes from childbirth or what we call postpartum. We then may have some teenagers even who have quite a lot of hormone issues as their hormones develop and cause problems. And then we have women in their 40s and 50s with perimenopause and menopause that cause a lot of hormone disruptions. I think what a lot of people don't realize is how critical our diet and our nutrition is looking after our hormones in our body. Not only does it help feed our cells, give us the right energy and reduce our stress that our body's under, it also helps how our body actually processes our hormones and allows our body to respond to that. If our gut isn't healthy, we cannot metabolize our estrogen correctly and clear it. If our gut isn't healthy, we may not be absorbing the nutrients, giving us the energy, which will cause more fatigue. So diet and nutrition are critically important. In different stages of life, there are also different requirements. Women who are older will need a lot more protein to maintain their muscle density. Women who are younger don't necessarily need quite as much unless they're training a lot. There are lots of different health screenings women can do, and these will vary on the age that you are. So women who are younger, they may get more frequent screenings, usually every 2 to 3 years for things such as pap smears. We may be teaching them to learn about diabetic regulation, glucose, lipids, things such as that. As women get older, there are other screenings that become just as important. So you're still going to go for your pap smears, but once you're over 40, you're going to start looking at getting regular mammograms. Those are usually every 2 to 3 years. People with a family history of colon cancer may start getting screening for that as early as 35. So that is women and men. So we don't want to forget that the ladies need to be going for their colonoscopies as well. As they get older, you will continue doing the pap smears, the mammograms, the colon screening, and then you may also do yearly blood work, looking at things such as diabetes, cholesterol, and iron levels. Unfortunately, some of the most common causes of stress in women are related to the amount of work, whether it be at a home or in a job that they're required to do. What I mean by this is that we unfortunately don't have as close a matriarchal society as we did before. In previous generations, our mothers, our grandmothers would all potentially live in the same house or in the same area, and they would all be supporting each other, taking on the daily activities. In today's world, there is a lot more pressure of women having to do this alone. They're raising kids without as much support. They're working a job. They may be required to work 2 or 3 jobs and be single parenting. This is a lot of stress on a woman and creates a lot of changes, not only to their hormones, but to their mental health, and causes their body to feel fatigued and exhausted all the time. Stress affects women slightly differently to men, and there are going to be lots of similarities, but when we consider stress in a woman, we consider how it will impact her day-to-day function. So what happens is she will start noticing she's getting more tired or have daytime fatigue. This may also cause her to feel more kind of heightened at night. Her mood will be a little bit irritable, and this is going to impact how well she sleeps. Now, if you can't sleep, that's going to snowball and essentially cause more stress in the body. It also may change how the woman feels with regards to her appetite. She may food binge or crave some sugar, or some ladies don't eat at all because they feel stressed. Now, this change in nutrition and eating habits, again, negatively affects the body in that it's going to cause more stress on the adrenal glands. It's going to change the energy levels. It's going to change the feel in the body. And that's going to really affect how the woman feels day to day and how clear her mind is going to be to keep doing the things she needs to do. This is where it's really important, where women need to decide what are the things that are necessary right now now, what can be scheduled slightly later in the same day, or what can be a shared task that she may be able to get someone to help her with. By doing that, doing those tasks in a graduated fashion, it will take some of the stress off. The other thing that women can do, it becomes a little tedious, but actually helps long term, is by doing certain tasks in bulk. We talk about food prep for athletes. If we can food prep at the start of the week, some of the things that we may need to feed our family or feed ourselves, it takes away some of that stress. We're able to eat healthier, have it prepared, and know that we're not sitting there at 9 o'clock at night trying to do tomorrow morning's lunch boxes. The third thing that will occasionally help, especially for the moms, is having clothing potentially for their children. So this is a little trick that some people do. They pre-lay out the entire week's clothing in a little way that each day the child's clothing is right there. You pick it up, you put it on them, and then there's no more thinking about this. It doesn't take a lot more time. And each day, even you can teach the children, this is Wednesday's pile, this is Thursday's pile. And it takes a little bit of stress off of getting the clothes out and having to get the kid dressed and do those other things. Unfortunately, a lot of women battle with mental health challenges. We talk about depression, we talk about anxiety, and these things really negatively impact a person's physical health. I think one of the biggest things that we tend to see with mental health, the person themselves usually becomes less active. So when we're less active, we always say things in motion stay in motion and things at rest will stay at rest. So the less you do, whether it's because you're not feeling well enough to do it, you're too anxious, or you feel social anxiety, what happens is you isolate at home. You may isolate from friends who can help support. You start doing less, and therefore the body becomes deconditioned. You might gain weight. You're going to choose other foods that are not as healthy. And this over long term creates a really big effect on the body. When we consider how do we maintain a healthy lifestyle in today's life, there is a lot of pressure. There is the cost of living, the cost of food. How do we keep that food healthy? How do I keep up with everything and pay my bills, be the best mom I can be? I think one of the biggest things in how we can do that is really to look for support. And we may not always feel like we want that support, but if we can find one or two friends, some neighbors, or even look in our own home at our partner or our children. And if we choose to work as a little bit more of a team, we may find that a little bit of that burden comes off and it makes life a little easier to live. And it makes it easier to do tasks when you have help and when you have those around who can help you. If we had to consider how important sleep is for our health, it is one of those key aspects like eating food and breathing air. It is critical, and without sleep, nobody will eventually function very well. And it can be very detrimental when you do not sleep on your mental health. So if we look at mechanisms to help with sleep, we of course have to look at, do you have a comfortable place to sleep? Are you warm or cool enough when you're sleeping? So making sure that you have a blanket or the right clothing to wear while you're able to sleep. Did you get enough food, or are you hungry when you're going to bed? If you're hungry, you're not going to sleep. And how can we make sure that you have enough to eat so that your body can feel that it can rest? So we want to consider body temperature, room temperature, bed temperature, and comfort. We want to consider, are you able to eat? Have you eaten enough so that you can sleep well? Do you have other good sleep hygiene? So this means that we've turned off other distractions. You know, if it's super noisy, you might have to put in some earplugs. If you're not able to keep the room dark enough, maybe get an eye patch so that you can reduce the light coming in. Do you potentially need to put some earphones on and listen to sounds or rain, or even just block out the noise? These are little techniques you can do at home that usually don't cost a lot of money, and you just have to see what fits your needs. I know when I sleep, I wear earplugs to reduce the sound. I wear an eye mask to keep the light out. And it has really helped how good I sleep compared to a few years ago when I weren't doing those things. The other consideration would be is whether or not you have kids or other people in the bed. Is the bed big enough? Not everybody can go out and get a bigger bed, but may there be more benefit that if you still have children sleeping in the bed, that it might be time to put them in their own bed so that you don't have them squirming around and waking you up. If you have a partner that rolls around a lot, do you consider putting a little pillow between the two of you? Not to create too much of a barrier, but just to reduce how much it might shake you and wake you during the middle of the night. We also want to consider really reducing electronics, reducing exposure to stimulating activities. So some people really don't do well if they're exercising right before bedtime. You don't want to watch necessarily a big action show or a super scary show just before bedtime. You want to reduce the electronics. You don't want to be scrolling. Those things really stimulate the brain and they disrupt your brain getting into that more calming state. So I guess be warm enough or cool enough. Ideally, you would want to be comfortable enough. So really trying to figure out that comfortable bed. Make sure that you have eaten if you're able to. If there is a lot of squirmy worms, whether it be your kids or an animal or a partner, really look at other ways to reduce that and then really reduce the electronics, reduce the stimulation. And something that I can say that is really underrated is the effect of like horror shows and scary movies and things like that, especially if you have some mental health. Really avoid watching those kind of shows, especially before bedtime, but really at any time to reduce the stress that it causes. Something else that is critically important, whether you're a man or a woman, I'm speaking about women here, so I'm going to give my opinion on women, really physical activity and exercise. And this is where people believe, I don't have the money to go to a gym, I don't have the time to go to a gym, I can't get a trainer, I can't always be doing as much as I see on social media to be doing. Really, movement is about keeping the body in motion, as I said before. So we talk about at least 30 minutes a day of activity. When I say 30 minutes of activity, it is any activity. Walking, jogging, hiking, whatever you want to do, but it does have to raise the heart rate above about 100 to 110. You got to go above that. So the slow walk with the dog is really good for cardiovascular health, but it's not good for weight loss and metabolism. So we really want to focus on, if you only have a small amount of time, 30 minutes where your heart rate's going up to at least about 120. Ideally, 3 to 4 days of 30 minutes to 60 minutes of a mixture of some cardiovascular exercise and some weight training. As women age, the weight training is more and more important if we want to reduce things like osteoporosis and muscle wasting that tends to happen as we get older. This is very common in our perimenopausal group where the estrogen drops, the muscles start reducing, and the bones need those muscles to stay strong. Exercise, movement, fresh air, those things are also critically important for mental health. And we know people, as I mentioned earlier, with anxiety, with depression, might isolate, might stay home, they don't move. Really, one of the things that will really help reduce how much that affects them day to day is by getting out or doing some activity, whether it be in nature, whether it be at a gym. Even if it's at home, if they can even just get a stationary bike or stand on the spot and marching on the spot while they're watching a show, it can be done in any budget and it will make a massive impact on how well our brain functions with day-to-day stress. Something that we often see patients battle with when they have mental health issues and challenges is isolation. And, when patients or people are isolated, it can be out of fear, it can be out of anxiety, it can be out of depression. It may be that they're so overwhelmed. And these are people where we want them to know that there is support out there for them, whether it be simply for them to get out and have a walk, see the neighbor, wave. The other option are things like going to an animal shelter. You can go and just spend time with animals if you're not comfortable speaking to people and hanging out with people. There might be organizations where you can volunteer some of your time. So even though you're feeling overwhelmed, you're able to go to a women's shelter and maybe be the support person for somebody else who is challenged just as much as you are. There are a lot of resources in the community where it doesn't always require you having to be happy-go-lucky and show up perfectly, but where you can just by simply showing up, possibly change how you're feeling by either being there for somebody else, for a pet, for an animal, or even just a wave to a neighbor or an elderly person who might be alone as well and isolating as well. I think the one thing that we all know is that nobody's getting younger, unfortunately. And since we haven't found the fountain of youth, we need to talk about aging with better grace or aging with more longevity or aging stronger, aging younger. There's all these terms out there. The big, I think, aspect about aging with more health is how we need to focus. What are we eating? How are we moving? What is age appropriate? And what diseases can we prevent by being more cognizant right now about what we're doing day to day? How is the fuel that I'm putting in my body now impacting how well I'm going to age later. How is the exercise that I'm doing? So the more resistance training for myself as a woman in my 40s is critically important as I get to my 50s and 60s to try and help maintain my muscle mass and my bone mass. How reducing certain food types, especially processed foods, processed meats, will reduce my risk of colon cancer. How eating non-inflammatory foods, so increasing leafy greens, having fresh foods, vegetables, foods that are not processed, how this is going to reduce not only colon cancer, but improve my mental health because I'm going to think clearly. It's going to help my energy levels. And this is going to allow me to feel my most virile and strong as I'm aging and allow myself to look after myself better. Something that we never think about, but all of us are exposed to this day to day, is the amount of negative stimulus in our life, whether it be from shows that we watch, even the news. The news has bad news more often than it has good news. We have horror movies and shows. It might be around Halloween time and we're going to go through these horror houses. Then we get negativity because our friends are always complaining about something. The teachers are complaining. We see that unions are striking. Everything in the world can be quite negative. And this does have a dramatic effect on how well we feel about ourselves. If I'm constantly surrounded by negativity, it's eventually going to make me feel like I'm negative, and it's going to take away the ability for me to really kind of constantly be positive. So I'm not asking you to always be positive, but what I would suggest is if there are ways that you can reduce negative stimulus, I would suggest it. I'm not saying completely avoid the news, but what I would say is don't watch that newsreel about something negative over and over every evening. Try not to read every bad story that's out there. Maybe don't always watch the scary movie. Maybe plan that for, once a month or something like that. But if we can reduce negative stimulus and we cannot focus on this negative energy, we're able to create a lighter, more positive natural self. And this helps us then achieve the other goals, such as getting out there and moving, choosing better foods, being more positive at home for our kids and our partners. So if there are women out there going through hard times, and hard times may be financial hard times, they may be emotional hard times, mental health, they may be physically with your health, you may be battling cancer or illness, you may be in a situation of danger with a spouse or with your children or with somebody around you. Know that there are resources around you. Whether you come to the doctor's office and ask us for help, whether you go to a shelter or any other community access areas, reach out. Even if it's to a neighbor, even if it's to a worker somewhere, and ask for help so that we can be there for you in a way that will help you stay healthier and not expose yourself to any danger. Another group of women that I definitely want to reach out to and encourage to say that if you're possibly a first responder or somebody similar to that, working in environments where we know there are extreme amounts of stress, extreme day-to-day variation in what the job might entail, and of course, a lot of traumatic exposure, I would encourage those ladies to reach out to a peer. If you feel that you cannot reach out to your peer group, those that work with you, possibly reach out to somebody else in the environment or in the neighborhood, whether it be a physician, whether it be someone who works in the community, whether it be an elder or somebody else with more experience. Reach out to them as well, because the amount of stress that can come with being a first responder is really immense. And we see a lot of these women really battling. They deserve a chance to be healthier, to be there for their families. So I would encourage ladies, any of you who are first responders and are really battling, whether it be with mental health, physically not having enough energy, or you can see that your health is declining, don't be ashamed to reach out and ask for help. I'm Dr. Tracy Lotze, and thank you for having me here today.